Cool. And just everybody make sure your name's in the chat. So next Monday's Labor Day. Got a message from Dean Brown today. And since it is an exam week for you guys, I'm going to be sending out, since this is the only RN class I take, or teach, I'm going to have to send out to you all the other sections, right? All the other sections that are taught. And then you're just going to have to let me know which section you're going to go to. There's like 11 other sections. Okay. And I'm even willing, if we can come to some consensus, even with a large portion of you, I'm even willing to set up another time during the week and do a exam with you guys. I know everybody's schedule is different and I get it. So why don't we start with me sending you out all the different, well, let me see if I can pull something up here. Let me share my screen. Oh, hang on a second. Let me see if I can pull something up here. Oh. That would be in the RN. Let's see. Teaching schedule. Are we in July? We're in July to October. Right. Okay. So let me share my screen and show you all the different sections, but I'll copy this. Megan, that's fine. So there's all the difference. There's all your different options. Okay. And I'll send this out. I'll probably just send it as an attachment. So if you guys want to take a look. So obviously I'm out Monday, but there's Tuesdays. There's 2 times Tuesday morning, Tuesday evening. Wednesday, there's an opportunity 1 to 3. This is all East. Another 1 to 3. Thursday, there's a 3 to 5. And Friday, there is 2. Okay, so it looks like there's 2 on Tuesday, morning, afternoon, 2 on Friday, morning or evening, Tuesday morning, Tuesday evening, Friday morning, Friday evening. And then Wednesday and Thursday, one opportunity. Wednesday 1 to 3, Thursday 3 to 5. Okay.
What if if you're not available any of these times?
Well, it has to get done sometime next week. So that's a lot of opportunities. I mean, it's 2.
I work 7 to 4 each day, and then I have class. The only one I don't is Friday.
So,
I'm traveling Friday.
If you were to set up like your own exam time, like if the consensus was that would work,
yeah.
What day would you think?
I don't know.
I know that you have a lot going on too.
Well, I teach 4 classes. So let's see, I teach 2 on Monday, which is not an issue for next week. So I teach I teach in the PN program, I teach Tuesday morning and Friday night. That's what I teach. So and my other 2 are Mondays. So I don't know. I mean, there's 1 Tuesday night, there's 1 Friday night. I guess I could do one. I'm traveling next Wednesday, but Tuesday night, maybe Thursday night. What do you got? I mean, again,
most of us have a PED sim, but we could totally just come
right.
take an
That's
exam.
what I'm thinking. So
or we can bypass that.
It's up to you guys. I'm happy to create another time slot if you guys want to take the exam. Like I'm thinking evenings are probably better, right? So Wednesday, I don't think so, because I don't think I'm flying. I don't think I land in Denver till like 6:30. Wednesday is kind of the only day I can travel next week. Because I don't teach on Wednesdays. Thursday, I could maybe do something in the evening. I know there's a Thursday 3 to 5, but I could maybe do like a Thursday, same time, 8 to 10. I don't know. I mean, just out of curiosity, just by show of hands, would Thursday 8 to 10 work for anybody?
I have class until 8.
Yeah, I was gonna say most of us have our,
We have
our
sim.
sim for peds.
Okay, well, I mean, you're coming from peds now, right?
No, like on campus.
In person. It's a sim.
Oh, well then, could you take it on campus? At 8?
We all have different
We have
times.
class
My class is from 8 to
11.
Yeah, see, that's
or 11.
right. That's my point, is I don't think we're
Yeah.
gonna come
Oh
up
no,
with
I
a,
was just asking if
Yeah,
there
no,
was-
I'd
if you had
like
it already
to.
in your head.
yeah, I mean, if, let's see, this class has three campuses. It has Columbus, where's my RN? Hang on. We have 3 campuses. So what I'm, is that you guys? Yeah. Columbus, Cincinnati, and Cuyahoga Falls. And we only have, I think Juliana, you just came on. I think we only have 1 student from Cuyahoga Falls, Juliana. But everybody else is from Columbus or Cincinnati. If you guys want to get together as a group, you know who your teammates are from your campus, and come up with a day and a time. And I'll let
I'm
you
good
guys,
with
I'll let
Monday,
you guys do
the holiday.
I'm sorry, what?
I'm good with Monday, the holiday, because I'm off work during the day
Yeah,
and in the evening, but I don't know what your schedule is.
well, but it's a holiday, so yeah, I mean, I don't know if people have plans, or, I mean, I don't, I'd rather, let's do a consensus. So why doesn't somebody take the lead on the Columbus campus? Somebody take the lead on the Cincinnati campus? Email your peers. I mean, I'm going to send you out all these other ones as well. I mean, I know I heard from Robin, but is other than Robin, are there other people that none of those other times will work? None. Tuesday, Wednesday, Thursday, or Friday? Are there other people that none of those times work, or can you see yourself fitting into one of those slots?
Can do Friday.
Okay.
I can do Friday night.
I'm gonna do Thursday.
Okay. So, okay, so other than Robin, is there anybody else? Tech, did you have your hand up, or were you just waving at me? I can't hear you, Tech. So other than Robin, is there anybody, just raise your hand, if none of those other days work? Then Tech, just put it, we'll put it in the chat. Will any of those other days work for you, Tech? Just put it in the chat. So by Blake and Jill, can you turn on your camera, please? Oh, Friday will work. Okay. So you get 2 opportunities Friday. So actually, how about this? If none of those times are going to work for you, put it in the chat. So where's Robin? So Robin, there's 2 evening ones. There's a Tuesday and a Friday. You said you work till 4. So
So Tuesday, we have class on campus until 8:20.
okay, what about Friday?
So Friday, I was planning on traveling, but I will I will make my arrangements so I'm either I'll travel like after or before that and make sure that
Okay,
I can get on then.
okay. So you could make it work if you needed to. Is there anybody else that it's not going to work for, any of those other ones?
What was the
Everybody-
time on Friday?
One in the morning, 9 to 11, one in the evening, 8 to 10. All right, so think about it during the class. All right, if there's no way you can make any one on Tuesday, Wednesday, Thursday, or Friday, then let me know. How about that? So I don't need any buddy from Columbus or Cincinnati to go through and ask everybody. It sounds like everybody so far can make arrangements to take it during one of those days. But I'll send out an announcement. I have to know which one you want to do because I have to send that instructor your name and the passcode. Okay? All right, so I'll send that out. Hopefully you can try and get to a review this weekend for exam 3. Group projects, I'm hoping to grade tomorrow. From what I've seen so far, they're really, really good. Really good. So yeah. Really proud of you guys. That's awesome. Okay, does anybody have any questions? So we dealt with Monday. We're in week 8. So this is actually the last class of content. Okay, week 9 is exam week, right? Week 10, we use our class time to go to do a HESI review. And that's also the HESI review week that you have to still come to class for attendance, but I'll send you out all of the other sections as well, because you can go to as many sections as you want in week 10 to go to as many HESI reviews as you want. Make sense? So just come to class, but then you go to any other one. If you want a different perspective from a different teacher, the information should all be the same, but just different teaching styles. Okay? And everybody has their HESI study guide, correct? Okay, cool. All right, questions? Did we cover everything? This is the group. No, we don't have anybody from Nashville. Okay. What else? Nobody has any questions? Okie dokie. All right, I'm going to do my best to get this. I've been trying for 2 hours. I'm going to do this right with Cahoots. Okay. The only issue I think we might have is it says only.
Tiffany and Starla are experts at Cahoots.
Awesome.
Because when we do review for exams, like we'll make a Zoom session with each other and then they'll log on and like make their own Cahoots. And then we tried doing it for a couple of different ones.
All right. So I've got resources in this group. The only thing I think might be an issue, it says I can only invite 10 people. So if I don't,
I can watch. I don't have to like respond.
What?
I can just watch.
That's what I mean. So if people want to get on and actually get in there and play to win, that's fine. If people just want to hang out and watch, I'm fine with that too. So I don't want anybody to feel shortchanged. And if you guys want to decide which 10 of you can get on right now, I don't care. It doesn't matter. I just want everybody to have access to it. So I'm going to see if I can do this right. All right. So I'll share my screen. And whoever is, oh, Tiffany, you want to watch? Okay. So
I'll watch.
let's see how this goes. All right. So you guys watch what I'm doing. I'm sharing my screen. There we go. Okay. I want to do this one first. I want to do the primary, secondary, and tertiary first. Okay. Let's do that first. Y'all with me? God, I hope this works. Okay. start. And then do you all have to put in the code I get? How does that work? Okay, I was getting messed up here. You got to catch it. Oh, God. Man. What am I doing wrong? This was working earlier. Is there something I'm doing here, guys? We're going to this mode. There we go. Okay. So then you guys are supposed to take this code and put it in, right?
I get these all wrong. Are you graded?
No, this
Okay, I'm just making sure.
This is class this week. Okay. Waiting for players. Okay, so I think it's working. This will be an accomplishment for me. I hear that music. So what we're going to try and do is we'll answer a question. We're all going to talk and decide which answers are what and why. And then before we hit next, we'll talk about it. Okay. I only had 4 people and I was worried about 10. Anybody else want to get on? Plenty of
Brittany
room.
does.
Okay, I've got 5. Got room for 5 more. Then the rest we'll have to watch. That's it? Okay. All right, let's get started. Okay, this is primary, secondary, tertiary. Okay, you guys can talk out loud. Okay. What do you think it is?
Is it red?
Yeah, the red one.
Why?
Correct, the red one, because it's to prevent the initial occurrence of it.
The red one.
Steven. All right, good. So before I hit next, right? Okay, so what's this one? Actions that reduce the occurrence and establishment of chronic illness.
Tertiary?
Tertiary.
You sure?
Well,
Secondary.
not now that you asked.
I think it's secondary
Why? Why?
because isn't secondary where you're like putting plans into place and doing plans to prevent the chronic disease?
Right. Yeah, it's secondary.
Oh, so the action
Oh,
is
the
screening.
establishment's what confused me.
Yeah, right. So
Right.
so we've found that they're at risk. So we're going to try and put in actions to prevent it from getting any worse. Right? It's screening. You've identified the risk. What's blue? Screening to identify diseases in the early stages before the onset.
That's secondary.
That's secondary.
Okay. What about managing disease post-diagnosis?
That's
tertiary.
tertiary.
Okay. Does anybody have any questions about that? Okay, let's go to the next one. Anybody want to talk out loud?
PPD test.
PPD
test.
Anybody get green right?
Yeah.
Okay, why is that the correct answer?
Because prevention is better than cure.
Because what?
Prevention is better than cure.
There you go. All right. What's a PPD test?
That would be like screening, so that would be secondary, right?
What's replacement of lost tissue through rehab?
That's
Tertiary.
Tertiary.
Okay. Routine treatment methods to terminate the disease process. What's that?
Primary.
Tertiary.
Tertiary. Why is it
Tertiary.
tertiary?
Because the
Great.
disease is already there and you are treating it.
Okay. Who's T? This.
Is it the green one?
Yeah, I think it's the green one.
What do you guys? Okay, what are you doing when you're given a Hep B vaccine? Isn't that preventative?
Right, but wouldn't those technically be all that select all that apply?
Well, these aren't select all that apply questions.
Right, no, I understand. So, but that's my question. If you're encouraging regular medical checkups, that's also a preventive measure, yes?
Yes.
I'm not arguing, I'm just trying to
No,
rationalize
yes.
the difference
In fact, yes. If this was a select all that apply, why wouldn't
So,
green
but in
be
this
correct too?
question, the Hep B is the most best answer.
Mhm. Correct.
Sure.
What is nursing assessments and care provided in the home?
Would that be secondary?
Mhm.
Secondary.
Why?
So now you're doing like screenings, kind of another
Exactly.
assessment.
Yeah,
Exactly. Okay, what's wrong with blue?
because they're in rehab, so that means they already have something wrong with
Which
them.
makes it
Tertiary.
correct. Guys understand that? This should be a no-brainer.
Teaching options for preventions.
What do you guys think?
Yes.
Okay. Okay.
I think
I'm-
it's secondary.
Secondary,
Training is secondary.
because
Please.
it's a screening.
Okay. Okay, everybody understand why? Because it's a screening.
That's tertiary,
Because
because they already have the cancer.
Tertiary.
does everybody agree with Robin? Okay.
Way to go, Nikki.
Just, can't, as soon as I get in front of tech, I'm gonna be done playing.
Then we'll have to stop the game.
Mhm.
That's
This should-
screening.
That is yellow.
Screening.
Screening.
Yellow?
Orange,
Yeah.
yellow, color that is.
Yep. Yep. What is red?
Tertiary,
Tertiary.
What's blue?
tertiary.
Tertiary.
What's green?
Primary.
Primary.
Okay.
Way to go, Nick or Shauna. The use of seatbelts.
Red.
Yep. What's orange? Rehab services for post-surgery patients.
Tertiary.
Tertiary.
Getting treatment for stage 4 breast cancer.
Tertiary.
Tertiary.
Support groups for addictive substances.
Secondary,
Tertiary.
Tertiary.
is that tertiary?
Tertiary.
So if it was like, if they were like discussing going to support groups, would that be secondary?
Well, it
Or would that
depends
still be
if
tertiary?
it sounds like the group is already for people that have addictive substances. So that gives them a diagnosis,
Okay, makes
right?
sense.
But if
Yeah.
it's said support groups for at-risk adolescents for addictive substances,
Then that would be secondary.
right? Does that make sense?
Okay. Yep, makes sense.
Okay.
Oh, Nikki.
Tertiary prevention.
The red one?
Yeah, the red one.
And why is it the red one?
Because they've already been
Sure.
exposed to the pesticide.
Okay, why isn't it the orange one?
Because if
we're-
you're teaching.
I just
that's
read that wrong and
secondary.
didn't have enough time, so I just clicked one. That's usually how it goes on exams too.
Erica.
When you run out of time.
Erica. Why isn't it orange?
Because we're teaching them, so that would be considered, wouldn't that,
Be primary.
yeah,
Correct.
primary.
What about blue?
Would that be
Tertiary.
screening? The
It would be
secondary?
secondary. Why would,
Secondary.
yes, because you're observing for risk.
You're like screening for risk.
Yeah. And what about green?
Primary.
Everybody understand that?
Mhm.
I know this seems repetitive, but we have to have an understanding of that.
Green.
Tertiary.
Tertiary.
Why?
Because they
Because
already
it
have,
already has osteoporosis.
Okay.
The blue.
yeah, the blue one.
Yeah, blue.
Okay, tell me why it's blue.
Because
Because we're-
for the medication administration, that means that they already have an illness.
That's exactly right. Okay, remember, look at the question. Look how it's asked. It's asked in the reverse way, which is not. You got to be able to pick up those words in the questions. Okay,
Yeah, we have.
why is that the
Why
correct
would-
answer?
But
But why would
Why-
you treat in secondary? Wouldn't you be screening and doing?
Which is not included in secondary. So what's treatment?
Rehabilitation.
What is not included in secondary?
Right, so rehabilitation is going to be your tertiary. My question is, why is treatment
yeah, I don't like this
considered
question.
secondary?
It's not, it's asking what's not secondary. Right?
Right, I get that. I get that the rehabilitation is tertiary. My
But
question
also like
is,
medicine too, right?
treatment is part of tertiary. The way I'm looking at it is treatment is tertiary.
And rehab is treatment.
Right.
And
So that's
medicine
my
is also
question.
treatment.
Pardon me?
Maybe treatments can be like screening. If somebody is going through treatments, screening is also part of treatment. So it's kind of general.
So that's right. So treatment can be looked at. Erica's looking at treatment and Stephen is looking at treatment in two different ways. What's the black and white answer? Rehab. Does that make sense? So Stephen, explain why you think treatment is secondary.
Are you saying because part of the treatment process is screening?
Yes. Yes, that's what he's saying.
Explain it. I'm sorry. Can you say that again?
Part of the treatment process could be screening, which would make it secondary. I don't like this
But
question.
didn't we just say in the previous question that going to homes in a pandemic and administering medication, which is medicine, is tertiary?
Mhm.
Yeah.
So then I would definitely get this wrong on an exam. And I get what you're saying, like rehabilitation that's the black and white answer.
Mhm.
I just would need to know why in the previous question, medicine is a
Mhm.
tertiary, but in this one, it's secondary. If that makes sense or not.
I
Keep
got it
going.
right, and I'm looking at treatment as if it's a treatment of the care that you're providing right then. Looking at treatment that way versus treatment afterwards.
Say that again, Jennifer.
I picked rehabilitation, and the reason I didn't pick treatment is because when I think of treatment, I think of the care that you're providing on a first line basis. So like you're coming into the ER and I'm going to give you treatment and we're going to go from there. Do you need medicine? Do you need rehab? Do you need, that's how I'm looking at it.
Without a diagnosis.
Yes.
Yeah, that makes sense. Erica, can you wrap your
and
arms
then I
around
think
that?
medicine, if
I mean, I get what you're saying. It's just, I get it. I get where the treatment statement is coming from. I do
Go ahead,
get it.
Robin.
with medicine, is it meaning because it's not, it could be part of primary, or I'm sorry, it could be part secondary, part tertiary, because like with the secondary, but then I thought vaccines were, I'm confused because
Well, let's
vaccines
say you take Jennifer's example.
are
You come
primary,
into,
right?
let's take Jennifer's example. You come into the ER or something, urgent care with a headache and they give you Tylenol. Right? You don't have a
But that's a
diagnosis yet.
Of
What?
headache. You have a diagnosis of headache.
Right. See, I know that I get it, Robin. I get it. I see where you're going. Yes. I think this is one of those questions where as a faculty, you guys would have to go through it. Right?
But you got to look at it too, like you don't necessarily have a headache when you first go in. They're treating a headache, but they don't know that's what's wrong with you.
Correct. Or let's move on.
Yeah.
Who's T?
Tech.
Tech. Oh, here we go with select all.
Green and red.
And blue. No, that would be primary, wouldn't it?
That's what I don't know. Is it
Not
considered
blue.
primary in here or secondary?
Green and red.
Okay. Do we understand why both of those are secondary? What is HPV vaccine?
It's for,
What's a vaccine? Pro-
papilloma.
No, but
virus.
It's something
vaccines
to
are
prevent getting something else.
correct. So blue is primary. And what's orange?
Tertiary.
Tertiary.
Correct.
Red and green.
I think it's only one answer.
Red.
Okay. Everybody
The reason
understand
I
why
don't think
that's
it's
red
green
at
is
the family?
because it says at schools, so that'd only be for kids. Is where dental screenings, I think that like could be for the whole family. That was
Say
my
that
thought
again.
process.
Say
So
that again.
on this green, when it says schools, I think of just the children.
Mhm.
They're only screening the children, but red, the dental screenings, the whole family can go to the dentist for
Exactly.
their
Exactly.
screening.
Exactly.
That's how I was thinking of it.
Yep, and that's exactly right. And when it says the family level, well, pregnant workers aren't necessarily family level. Programs at schools only deal with the kids. And mental health referral is what? Would that be a primary or a tertiary?
Tertiary.
Tertiary. Why?
Because he already has
They
it.
already have mental health issues.
Exactly. Okay.
Healthy eating habits.
Mhm.
I feel like that's wrong though. No.
Can we jump to the other? We've got through half of this because the other one is 60 questions and it covers content. And if
Yeah.
we have time at the end, we'll come back to this. How's that? Does that give you a good sense, at least a starting point?
Yes.
Okay, let me go back to. Okay, hang tight. Let me find 8. Okay. Okay, I'm going to share my screen. Okay, this covers, the rest of this is content.
Are you going to share this with us so that we have it as well?
Sure. I think, didn't I already share it with you in the announcements?
I don't know. I'll have to go and look.
Yeah, I shared it with you in the week 8 announcements. I said 2 cahoots below. It was primary, secondary, tertiary, and this. Okay. There's your code. 480-685. Text in there. Text gonna play by himself? Jill? I have room for 10. That's it? Okay, let's get started. You guys can talk out loud. What's the first?
Well,
what do you-
it's like the scientific method. You have to like have
Pardon
an
me?
issue in order to assess it, right?
Correct. So the very first issue in figuring out what your ethical decision-making process is going to be is figuring out what the issue is. Everybody understand that? It's kind of your assessment phase of the nursing process. Got to figure out what's going on before you can deal with it. Does that make sense? So if you haven't done any prep work for class now, for this week, all of this information might be new. This information is going to be new to you. Okay, so it might be a lot of information, but let's keep going through it. So one of the topics that was covered this week in the chapters was ethics. So that's where that question comes from. Oops, sorry. Multi-select.
Yeah, but Isabella, where is it? So,
Okay, so this is a question that you need to know the governmental agencies that are involved in healthcare policy. Okay, and this would be a definition question. This is on your study guide. Okay, there's a paragraph on your study guide that goes through 3 or 4 different organizations. Okay, and National Research Act is one of them. And so it's asking you, what does it do? Well, here's the two. Again, this comes from ethics as well, outlined ethical principles that are to be followed. And also it's protection of human subjects. Okay. So again, if you haven't looked at any of the information for this week, you might, okay, ethical principle for respect for persons. What is that? This is one of the ethical principles.
obtaining
Respect for-
informed consent.
What?
The blue and green.
Okay, there's just one answer.
Blue.
Okay. Oh, there's 2 answers. Okay.
I was gonna
So
say, I like yellow too.
yeah, okay. Allowing individuals to make their own decisions, that's autonomy. Obtaining informed consent, that's that patient determination act, right? So respecting people to make their own decisions. What is do no harm? Is that beneficence or non-malfeasance?
Beneficence.
Maleficence.
What is it?
The one starting with the M, maleficence.
Non-malfeasance.
Non-malfeasance.
Yeah.
Okay. Okay, and what's fair treatment for all? What is that ethical principle?
Distributive justice.
Yep. Good job, Erica. Okay, did everybody hear that? Another select all that apply.
Red and yellow.
Red and yellow.
Okay, good job. That was based on the last question. What is autonomy? We want as long as patients are competent, right? We want them to participate and be involved in all their own decisions. Once they become incompetent, then other decisions need to be made. But that's the Patient Self-Determination Act, where as long as they're competent, they are determined to be competent, therefore they should participate in all decisions about their care. Okay. What's beneficence? Another ethical principle.
Is that green?
Green.
I have no idea. I'm just guessing.
Don't guess. Beneficence.
I got it right.
Do good. Do good. That's what beneficence is. Do you strive to do good? Non-malfeasance. You strive to do no harm. Okay. Everybody understand that? Utilitarianism. What's that? It's a theory. It's one of the ethical theories.
Is it yellow?
Yep. Why is it yellow?
The
Outcome.
action must
It's all
justify the-
based on outcomes,
Yeah.
right? Doesn't matter how you get there. It's outcome driven, right?
Mm-hmm.
Guys, remember that? It's deontology. Another ethical theory. So somebody give me an example of deontology. What would an example be?
I don't know.
Like
There's
CPR?
so there, go ahead.
Sorry. Like
No, go ahead.
CPR? Like doing CPR?
Mhm. Yeah, that's a good example. Yep. So you need to know your, this is in your study guide. You need to know your ethical principles and your ethical theories. Does anybody have the study guide pulled up? I have it right here. Hang on. Hey. Ethics. Okay. So on the second to last page. Okay. So I'll read you the second paragraph under ethics. This is your ethical theories. This is right in your study guide. Utilitarianism is the ethical theory that outcome is the key. So the action must justify the means. Deontology is a theory that adheres to moral rules, okay, rather than moral rules or duty rather than consequences. And then we know what distributive justice is. We talked about that. And the fourth one is consequentialism. Okay. And that's based on the consequence of your action. So that's right on your study guide. Okay. The first paragraph on your study guide under ethics is that National Research Act. Okay? So for ethics, let's see if these are going to come up in a question.
Good job, Jill.
What?
I said, good job, Jill. She's in the lead.
Okay, what's distributive justice? I just read it.
Fairness.
Think about what distributive justice looks like. Why is it that?
Because they don't have the goods and services, then, or like supplies and stuff like that, it becomes a
Right.
burden, right?
Equal access. Correct. Yep. Okay. This is the third paragraph in your study guide. It talks about feminist ethics, virtue ethics, caring
the above.
ethics.
Green. Oh.
Agreed.
Okay, good. That's specific to feminist ethics. Perfect. Good job. Well, virtue ethics. Think about it. Virtue. What are virtues?
Green.
Yeah.
Yellow.
Green.
Green.
Virtue ethics enables persons to flourish as human beings. That's what virtue ethics is about. You know, the good news is this is all kind of organized. So anyway, I'll tell you in a minute. What is non-malfeasance? What did we say it was?
Do no harm.
Do no harm. Perfect. Right? So far, if you're going to redo this, because it's in your announcements, the first, okay, now we're starting on a new topic. So the first 11 questions are on ethics. If anybody's taking notes. Okay, now we're talking.
Green. Green.
Okay. Great. Just trying to go on. Let's,
Green.
yeah. Does everybody understand why all those are correct when you're working with immigrants? Many, many issues, many, many barriers. And this identifies them. Several of them: financial, language, social, religious backgrounds, cultural backgrounds, practices.
Red.
Red.
Yeah, red.
Okay, so
Yellow.
Isn't it a select all?
Oh, I didn't realize.
It was
I didn't
select
realize
all.
that behind.
okay.
didn't realize.
Yep. So one of the two things you have to understand the difference of is what's the difference between an immigrant and a refugee. Okay, let me find it on your study guide.
Isn't an immigrant who just like wants to move to a different country to like better themselves, things like that? But a refugee is somebody who like is basically forced to leave because of something horrible that's happened.
Correct. Correct. Yeah. So this is under the section on page 7. It's under these questions starting at number 12 start with it's under the header cultural influences in nursing. Okay, and here it describes the first 2 paragraphs. The first one is about immigrants. The second one is about refugees. Clients who are refugees have often left their homes due to disaster or under horrific circumstances. These clients are often experience traumas such as torture. Priority for the nurse when planning care for an immigrant, remember this, priority is to access therapy for them. Make sense? To deal with their psychological trauma. Okay. Other barriers they have: navigating public transportation, understanding social norms, communication barriers can impact care, but therapy is a priority. So that's if you're asked on the exam, what's the big difference between immigrants and refugees? Okay, refugees, their priority is therapy. Okay. Makes sense, guys?
What? On going outside today. We did 3 walks in the wagon.
Can somebody mute themselves, please?
Yes, we're not on mute.
Tiffany, you're not muted. Where you had left.
Who needs to be muted? Just somebody
Got
throw me
pizza
on
and garlic
name.
bread and macaroni.
It's Tiffany. There you go.
Okay,
Is it yellow?
Native
yellow.
American. Good job. Awesome. That's also on your study guide.
Why is, because I thought it was more, yeah, I thought it was yellow.
Oh, wait.
Yeah, because they are oriented, they are future
Yeah,
oriented.
that should be often past oriented is also a correct answer.
Okay,
Okay, which is the same as may not be concerned about the future.
yeah.
So let me give you a scenario. This is on your study guide. Let's say you're working with a Native American family. Let's say somebody had a stroke and they need to plan ahead for rehab visits. Because they're past oriented, they may not be concerned with the future. Might they need some assistance with making all those appointments in the future?
Yes.
The answer is yes. So that's an example. Okay, so yellow should be the correct answer as well. Select all that apply. So communicate with Hispanics.
I would say yellow and green.
I would say red, blue, and green.
Red, blue, green.
Direct eye contact, avoid using negative expressions, physical contact is expected. That is it. This is questions in your study guide. Okay, so questions 12 through 14, no, 12 through, what number are we on here?
17.
So 12 through 16 were cultural influences in nursing. Did you guys know this? Observation and surveillance. Think of the nursing process. Okay, what are you doing when you're observing?
Your assessment
Mhm.
and your
Runs-
evaluation.
Mhm. So just think about it. If you, let's say you're part of a COVID team and you're doing observation and surveillance, what are you doing? You're analyzing and interpreting the data, right? You're collecting the data. And you're disseminating it. Right? So you need to study the section on surveillance. This is the surveillance outbreaks. Is this question number 18? 18, yeah. Okay. What do you guys think? Do you understand that? So,
Yeah, I just didn't take it the next step, which is the observation.
which what?
I got it. I figured out where I went
Okay.
astray.
One of the things we need to know, and I don't know if there's a question about it. What is the purpose of surveillance? You can't do, oh, I was going to say you can't do green, you can't do blue. Why? You can't eliminate all infections, right? You can't eliminate all community-based infections, right? So why are we surveilling? We're trying to, let's say there's an outbreak of something. We're trying to control the spread, and we're trying to reduce morbidity and mortality. Okay, this is right in your study guide. Okay. Okay, so here, oh wait.
Is it case-based surveillance?
What do you guys think?
It's based.
I don't know.
Okay. So these are types of surveillance systems, okay? Surveillance systems are important. I'm just reading from my notes here. For early detection of disease and implementing interventions to reduce morbidity and mortality. We had that in the last question. So it talks about systems. Okay. Oh, that's passive and active. Oh, hang on a minute. No, it's here. Case-based, let's see, intermittent, mixed. No, we don't have that. This isn't on your study guide. So in this chapter, these are the 4 different kinds of surveillance systems. There's a case-based, a sentinel, and a syndromic, and a behavioral. Okay, so I'm going to ask you to go back into your surveillance chapter and put these on a card. This is a definition question. Okay, you will get asked something like this on the exam. So we need to know these 4. Okay, thought it was passive and active. Okay. The rest, okay. I'm gonna make a note of that. So surveillance systems. Which is not a surveillance system. So we know that Sentinel is because it was on the last slide. Okay, we also have active and passive. Okay.
And crowded brain.
So it's disease, which is not. So let me tell you about passive and active. Okay, passive system relies on healthcare providers to report existing cases. So that's what I did as a school nurse. The health department depended on me in the schools to report something to them, chickenpox, pertussis, whatever it was. Okay, that's passive. Okay. Active, okay, the health department then searches, or let's say health department then searches for more cases. Does that make sense? So let's say it was a foodborne illness. Okay. And an emergency room reported to the health department that they had 3 people who came in sick with GI stuff in the last hour, and they all ate at the same restaurant. That's passive. They're reporting to the health department. Then it's up to the health department to now take an active role to figure out, are there more people and how do we track them down? So they may be calling around to the other hospitals saying, hey, if you get this, if you get any patients with this and they ate here, please let us know. Does that make sense? Oh, okay, I just explained what it is. Okay. So this should be easy now. I just explained what it was.
Blue,
What?
blue.
Yeah, it relies on people to report something. Emergency rooms, urgent cares, doctor's offices, schools. Okay, so that's passive. This is on your study guide. What's an advantage of a passive system?
Simple collection.
What do you guys think? Simple collection. Yep. Okay, so these are patterns of occurrences. Okay, so
Green.
okay, so let's stop here for a second. Okay, this is a point source. Let's see. So one of the things we talk about is patterns of occurrence. This is still in your surveillance section. We talk about patterns of occurrence for outbreaks. Okay, so different patterns of occurrence are used when investigating outbreaks. Okay, so here there's several kinds of patterns. There is a point source, there is an intermittent, there is a mixed outbreak, and a propagated outcome. So there's like 5 of them. Okay, so that's it. There's a section of that in your study guide. So these are all called point source is one of the 5 patterns of occurrence. Okay, and points are, it says comes from a distinct location such as a drainage pipe. So I always use the example too of, let's say somebody releases gas on a chemical gas on a train. Okay, which means everybody's going to get sick at the same time. Okay, does that make sense? I don't know if it's going to ask about the different ones. So let's see. Okay, so now it's giving you the definition, asking what kind. Okay, so there's 4 of them. Okay, so what do you think this is just by reading what the question is?
Intermittent.
Why would it be intermittent?
Because they're over a period of time and they're at different times.
Yeah. So like food poisoning, let's say you were eating in a restaurant and they were using contaminated lettuce, but they were using it over, I don't know, 2 days. Right? People get sick at different times. It may not kick in immediately. They may get sick the next day. Make sense? Okay, so this is a matter of knowing your definitions. Okay, and this is in the study guide. So it doesn't have a common source, and it spreads gradually from person to person. Again, this is just knowing your definitions. Okay, that is a propagated outcome. Make sense? Is this helpful to be doing this?
Yes.
You should do this next term too.
Okay. Okay,
Primary.
yeah. Why is it primary?
Because it's a vaccine.
What do you have to do first?
Assess.
Think of
Identify.
your ad pie. What do you have to do?
Assess.
Okay. Or when you're developing a program, you can't do anything. You can't develop anything unless you know what the needs are. Right? That's ad pie. Right up. Straight up ad pie. So now we're in the section of
All of the above.
we're in the very first section of your study guide. It's called Community Assessment and Evaluation. Okay, so what's the purpose of a community health assessment? Analyze, that's part of your ad pie. Prioritize needs, part of your ad pie. Future needs, right? So it's all of them. Does everybody understand why it's all of them? Ah. So this is a definition question. Do we know what these are? You need to know what these are. Hang on a second. I want to make sure I read you the right. Hang on, I think that is still under, one sec. Okay, so this question is still under the surveillance. Okay, so no, it's not. No. Yeah, it still is. So when developing a community-based program, the nurse needs to conduct a needs assessment. That was 2 questions ago. Okay, there's 4 different stages. This is right on your study guide. Okay, there's a pre-active stage where the nurse predicts, so right here, the nurse in the pre-active, the nurse projects future needs. Okay. And then you have the reactive stage. Has anybody looked at this, or is this all new that I'm reading to you? Okay, so in the reactive stage, you're determining what the problem is based on past identified needs. Okay. If anybody has a study guide, you can just kind of follow along here. Okay. And then the inactive stage, which was the correct answer, it's based on existing health status, which is what the question is. Okay. And then the last stage, the inactive, which is the green. It's based on using past data to project future needs. So this is a definition question. Okay, so again, you may be given a scenario like this, and which stage is it? Okay. I know it's a lot of information, but this is a really good summary. Okay, what's patch? Okay, this is the last part of your surveillance. What's the patch model? Okay, so this is the patch model is basically how do we get
Green,
what?
green.
All of them,
Well, yeah, it is all of them.
right? So there are 3 different models in your study guide again, 3 different models of community involvement. Okay, the first one is the patch. Okay, this is used, again, more definitions. This is used for program planning. Okay, and it focuses on all of these, mobilizing the community to act, collecting data, choosing health priorities, and developing comprehensive plan and evaluate the process. Okay, that's one model. Let's see if it asks about the next one. It does not. So make sure you, okay, answer this question, then I'll go back.
Red.
Excellent. Excellent. Let me go back to the last question though. There's 3 models. We only had one question about the patch model. There's 2 more models. There's the assessment protocol for excellence in public health. That's the second one. And there's called the MAP, the MAPP model. Okay, which is the mobilizing for action through planning and partnership. These are 3 community models that are used for assisting with surveillance of outbreaks. Okay, so know those 3. We only asked about one in here. Okay, sustainability, the most important thing when you're evaluating programs is determining, when you talk about sustainability, does it have the funds to continue? That's what sustainability means. Okay, that's the most important thing. Okay. Okay. Getting close, guys. Select all that apply. There's a section in your study guide
I say red,
Red.
yellow, and green.
Right.
Okay, so let's stop and talk about this. On page 6 of your study guide, there's a section called Managing Quality and Safety. Okay, and the 2 things that we need to know in this chapter, what's the difference between continuous quality improvement and quality assurance?
I read into that question, like, because on the study guide, it, so does it, the post event investigation, I read into that and assumed it's used to improve quality and safety.
Okay.
Because that's what you would take from a post-investigation, right?
So continuous quality improvement is exactly what it says. We're continuously trying to improve the quality of whatever, whether it's fast food, getting the food out, hospitals taking care of the patient.
Well, because I selected A,
Oh.
or I selected red. I selected all three instead of just the two.
Okay. So let's go through the two continuous quality improvement. Let's go the two correct answers, right? Performance improvement. That's obvious, right? And then process improvement opportunities. That's obvious. Okay. But if you talk about quality assurance, okay, that's the other CQI and quality assurance. Quality assurance is the other two. Okay, so continuous quality improvement is trying to be proactive. So maybe your organization is sending you surveys. How can we do better? Sending patient surveys. How could we have done better? They're always trying to improve. Where quality assurance is, you're trying to assure the quality where it looks at issues. Okay, so your quality assurance department may be involved if there is a series of hospital-acquired infections. Patient died in the OR. Increased risk and increased falls. Okay, where they're going back and looking at what happened. And in the end, it's going to require blue, changes in practice. And what does it do? It's used to improve quality and safety. Okay, because it's quality assurance is really for when an issue has happened, where continuous quality improvement is trying to be proactive. Does that make sense? That's the first paragraph of that section of your study guide. Select all that apply. Oh, I probably just gave you the answers here. Here's quality assurance. You guys think? Okay, so that's what I just said. Fixing blame, performing a post-event investigation, something has happened. Okay, so part of your post plan will probably be planning for continuous collection of data, right? Because we don't want this to happen again. Okay? Make sense? Another select all that apply. It's a pretty easy one here, guys.
Green and red.
Oh, select all that apply. Okay. Red for sure. What other one?
Green.
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 Green one.
Yippers. Do you understand why? Does that make sense, or do we have to go through it? Right. So tell me who has not been to an in-service on quality improvement where you work. Anybody been to an in-service on how you improve customer service, how you get customer feedback? Has everybody been to those kind of trainings or in-services? Of course. Okay. And this is a big one. Improve client satisfaction. Okay. Not that monthly educational classes to focus on competence is important. That's, we as nurses go through competency trainings, right? I know in my school nurse job, we were required once a month to have some kind of competency training. Pick a task that school nurses do, and we had to go through a competency training. That's how you become better. Okay. Tracer method. If you haven't reviewed your managing quality and safety, you don't know, probably don't know what a tracer method is.
Red.
Okay. So in your study guide, okay, here's a tracer method. It looks at outcomes. It look at process and outcomes of similar outcomes. So hear me out. So this is part of going through the process of quality and safety. So if you're involved with the tracer method, okay, all these things have to come together. Okay. Same disease, same stage of illness, similar lifestyle, similar intervention, and live in the same community. Okay, all that has to be present for you to participate in the tracer method. And let me give you an example. Let's say there's 5 hospitals in the city, and they're all doing, they've been asked by the health department to all evaluate the way they care for stroke patients. Okay, same disease, same stage of illness, similar lifestyle, whatever. Okay, it turns out that one of the hospitals is able to get the patient home in 2 days, where the rest of the hospitals are 3, 4, 5, 6 days. So what was the hospital doing that they were able to get the patient home safely in a couple of days? And can that best practice or that new evidence base be used by the others? Does that make sense? Yes or no?
Yes.
Yes,
Okay.
that makes sense.
Yeah, it's based on nursing care standards. Can we assist each other in improving our nursing care standards? That's what evidence-based practice is all about. Okay. What do you guys think?
Yellow?
Who said yellow? Good. Good job, Robin. So this talks about one of the things you need to know with regards to this question, right, is when we're evaluating QI programs, there's different phases. Okay. You need to know the structure phase. Okay. The process phase and the outcome phase. Okay. So, correct. So does that make sense? Ah, I just told you. Select all that apply. Okay, structure and process, that's pretty straightforward from what I just read you. So second phase, philosophy and objectives align. That's basically the outcome phase. Okay? So there's your 3 phases. Okay? So again, know what your 3 phases are. Well,
Would it be
there's
the
no,
outcome phase?
okay, there's no orange phase and there's no green phase. Okay, those aren't phases. Or yeah, they're not. Okay, so it's either outcome or process. So you need to know your 3 phases. Okay. Last one, guys.
Red?
Hmm?
Maybe red, maybe not. Hold on.
Yellow.
Yellow? Oh, I didn't know it was a select all
Oh.
but apply.
Me neither. Oops.
Well, it doesn't say it, but it should. Everybody understand why both of these are tertiary,
Yeah.
okay? Complications, the first one, you have complications from a vaccine. And yellow, you have rehab from whatever happened. Okay? So, what do you think? Helpful? We went
Yes,
over,
very helpful.
we
Yeah.
went over a
I agree.
lot of,
Helpful.
yeah, we covered each of the sections we covered for this week. Okay, so yeah, that actually was very helpful. I would refer back to your study guide as well. Okay, this is this exam is definite. It's a lot of definitions as well. As you can see through what we went through is a lot of definitions. So primary, secondary, tertiary questions. Couple of healthy people, 20-30 questions. So this was kind of I know it was lecture, but it was kind of a review, which is great. Okay. I want to give you guys the best opportunity to do the best you can next week. Okay. All right, let's go do our attestation real quick.
Do we, sorry to interrupt, and I know you told us, but do we just email you a message on which,
Yeah, I'm going to
class or
send you
whatever we're
all an
doing?
individual message. Okay. And it's going to have all the dates out. And you just tell me which one you want. So you'll be responding to me individually. I'll just do an Excel spreadsheet and keep track of who wants to do what. But remember, whatever you sign up for, unless you let me know, that professor is going to expect that you're there.
Okay, sounds good. Thank you.
You're welcome. I hope this was helpful tonight. I actually enjoyed the interaction. I hope that you learned a lot. It was a much more organized way of just covering each chapter briefly. Okay, so remember, you're not just responsible for what we cover in cahoots. Okay, use your study guide. Your study guide is an excellent representation of the topics and concepts covered on the exam. Okay. If you need supportive literature, resource, knowledge above and beyond, go back to your books. Okay, go back to your foundation book. And you know, at the top of your book, you can search for a topic. You know that, right? Okay. All right, somebody read the attestation questions. Let's see if we can answer them. I'm just looking at all your faces. I don't have it pulled up.
The first question is, what are 2 types of disasters, and please give an example of each.
Can we not cover disasters tonight? Okay, there's a whole section in your study guide on disasters. There's 2 types of disasters. What do we think they are? Let's just think out loud.
The natural and human-made. Natural and made.
Okay, what's an example of each? What's an example of a natural disaster?
Tornado,
Earthquake,
hurricane.
Yeah.
Earthquake, hurricanes, maybe a communicable disease epidemic like COVID. What's a man-made disaster?
War,
Fires, water contamination.
Communicable infectious disease. Couldn't that be both?
Both. Yep.
I'm just being argumentative at that point, but couldn't it be both?
Oh, Erica, you don't
Not
have to be
argumentative, but
argumentative.
you know, like
I know what
it
you
could be
mean.
both.
I've got to know you good this term. I know where you're coming from. Let's see. Was the second question give an example of each? Or was that still part of the first question?
That was still part of the first question.
Okay. All right. What's
second
number 2?
The second one is list and define the main nursing ethical principles and why are they important?
Okay. So let's jump to our study guide. What are the ethical principles?
autonomy, beneficence, justice, and non-maleficence.
Somebody want to put that in the chat for everybody? Excuse me. I'm still fighting COVID. I am not actively contagious or anything, but I think I'm in that long COVID thing.
Did you, I know this is off the subject of school, but did you take the Paxlovid?
I did.
Did it did it make your mouth taste so nasty?
Ah,
Because
it was
mine
like-
is horribly, disgustingly nasty right now.
Disgusting.
Yes, mine is too. I have one more. I have tomorrow morning to take, and I'm done. But
Ugh,
yeah, it was like
it's
the worst
disgusting.
tasting I can ever imagine.
It was disgusting. Somebody just put real quick, Robin, hang on. Somebody just put this, Kimmy just put this in the chat if anybody needs to copy it. What do we say to Kimmy?
Thank you, Kimmy.
Yeah, it was.
Kimmy. Thank you, Kimmy.
Gracias, Kimmy.
So that's all I have for tonight. That was good. No, I really enjoyed that. I really did. I think it was a good summary from each chapter. Okay. Do you guys have any questions? I'll stay on for questions. Otherwise, I'm not going to send that out tonight. I'll send it out. I teach a class early in the morning at like 7. And so after I get done with that at 9, I'll send out the email about exams next week. And that will give you some time to think about what you want to do. Okay. And I guess maybe just to be thoughtful of the other professors, maybe I could say by Thursday or something. Is that fair? That you guys send me an email back? That way I can catch them before the long holiday weekend. They can put you guys on their calendar to show up. Is that fair?
I think that sounds good.
Okay. Anybody have any questions or feedback or try and get to a review, use your study guide. If you can't get to a review, listen to a recording. Okay. All right, well, I'm all done. I'll stand for any questions. It was good to see everybody. Have a great week. Okay. Bye.
Thank you.
You're welcome.